The Dallas Consensus 2.0 for esophageal motility disorders based on EndoFLIP findings. Normal flip is normal esophageal opening plus a normal contractile response. Non-spastic obstruction is reduced esophageal opening plus an absent or a reduced contractile response. This is seen in achalasia and EGJ outflow obstruction. Spastic obstruction is REO plus spastic CR, which can be seen in type 3 achalasia and DES. Obstruction with a normal contraction, which is REO plus a normal CR. This is seen in mechanical obstruction, ring, stricture, tight fundoplication. Inconclusive if it's borderline EGJ opening, and these people need a time barium esophagogram or an HRM.